Hi there, I'm Dr. Jordhen. I'm the Chief of Family Medicine at United Family Hospital in Pudong. I've practiced here in Shanghai for almost 4 years. I come from the US. And I'm going to be talking today about how to keep yourself safe from the novel coronavirus, now newly named COVID-19. So I'm going to talk about the ways that the coronavirus is believed to be spread, and for each of those ways that it's spread, then I'll talk about how you can prevent transmission. So there's 4 ways that a disease can spread. One is through droplets, which are large particles that can be in the air for a brief time. One is through contact, so on your hands. One is through fecal-oral, so spreading from the bowels and then usually through contact with the hands. And then airborne spread. While it's not entirely confirmed which ways the virus can spread, for each of these ways we can talk about how to prevent transmission. The most important way to prevent transmission and keep yourself safe is to avoid touching your face. The virus, if it gets on your hands, the skin is a really impermeable barrier, but if you were to then touch your eyes, your nose, your mouth, that's how you can self-inoculate. So hand hygiene is the most important thing you can do to keep yourself healthy. So I want to show you with hand hygiene what that looks like. So an alcohol-based hand sanitizer is very effective and can be used even instead of soap and water. What you want to do is rub every surface of the hand, front and back. Thumbs are frequently missed, fingertips, knuckles, and the whole procedure takes about 20 seconds, which is about the time to sing the happy birthday song twice. I timed that. It works well. So for droplet spread, hand hygiene is very important, because if you've gotten the virus on your hands and then you touch your face, you'll prevent transmission that way. So preventing spread from contact with the virus, we reviewed hand hygiene, avoiding touching your face, washing or using alcohol-based hand sanitizer for 20 seconds. Some other strategies: when you come home, removing your clothing at the door, removing your outer layers at the door is very important. And of course, you wouldn't wear shoes in your house, but after removing your outer layers, after removing your shoes, having your sanitizer right there by the door can be really helpful to perform hand hygiene after each layer that you remove. The next topic we'll talk about is safe use of masks. So one thing I want to point out now that we're really focused on our hand hygiene is the concept of being bare below the elbows, so avoiding wristwatches and in fact avoiding wedding rings. So at least for now, I'm going to be wearing my wedding ring on my neck to allow for better cleaning of the hands. So the next way that the virus can spread is through droplets. These are large particles that can hang in the air briefly. When somebody coughs or sneezes, then the droplets can spread up to 6 feet or 2 meters. One of the ways to prevent transmission through droplet spread is simply social distancing. Here, alone, outside, I'm really not at risk for coming into contact with the virus. But we can't always be so far apart from other people. So wearing a mask can be very helpful when you're in crowds, and it's in fact required when you're on public transportation. I get more questions about mask use than about any other topic right now. So I want to talk about different kinds of masks and what they do. One kind of mask, the simple surgical mask with the moisture-proof barrier on the inside. This is the outside. This goes over the nose, and it's very important to fit it to your face and pull down. Now this is a clean, untouched mask. When putting on, I'm touching the surface of the mask. Now when coming home, if I've come in from outside, it's very important to be aware that the outside of the mask now may in fact be contaminated. So when it's time to remove the mask, then you only want to handle the outside And if you don't have a medical waste disposal, you want to fold that contaminated surface inside, and then you can wrap this up and it's ready to dispose. Now, this should be the last thing you take off when you come in your house. You're going to take off your coat, you're going to take off your shoes, you're going to perform hand hygiene after each step, and then the last thing you're going to do is take off your mask, which now you've contaminated your hands. You want to do hand hygiene right there after taking it off. Now, for droplet spread, the surgical mask is in fact appropriate and will prevent droplets from transmitting. One of the really great benefits of having everybody wear a mask is the people who in fact are coughing or sneezing when they have a mask on. It's going to contain that infection and prevent them from spreading. Of course, if you have been coughing or sneezing and you have a mask that may in fact be contaminated from your own illness, disposing of it safely in a plastic bag and closing at home if you don't have access to medical waste is very important. Another kind of mask we use is an N95 mask. So many N95 masks that you'll find will have a valve, and that's to keep it cool. Now these, you're going to be protected from the PM 2.5 and will also be a good barrier preventing other people's sneezes from getting on you. Now, if you're wearing one and you're sick, you're not protecting other people as well with this one-way valve. When you come home and you take it off, again, you want to use a no-touch technique. You're going to remove one band and you're going to remove the other band, keeping in mind that the outside of this mask may be contaminated. And again, you're going to want to do hand hygiene right then and there, right after removing your mask. Now, in the hospital, we use N95s that are moisture proof and don't have a valve. And we use these to keep us safe when we're in close contact with people who are sick. One of the concerns is whether, in fact, this virus could be spread by aerosols. We just don't know. In the hospital, where we may be doing procedures that create aerosols, or dentistry or procedures like that, it is a very high-risk environment. And for that reason, it's important that all healthcare workers wear a fit-tested N95 mask. Now, in public, that's not practical. We also know that masks are in short supply for many people. So I want to reassure people that in a public setting, a surgical mask can be quite safe. Reusing a mask, the topic has come up. Can you in fact reuse a mask? Well, on that question, I reviewed a paper by Mr. Wen Yumei, or Dr. Wen Yumei, at Fudan University, who noted that you could take a mask and cover it with plastic so you're not going to spray any virus, and you can use a hairdryer on it for 30 minutes, and now you've effectively killed the virus. Now, that's not practical to dry every mask for 30 minutes, but if you're in short supply, that is an option. The virus can live on surfaces for a short period of time, but in cooler environments that may be even up to 24 hours. Now, I don't have any data on this, but it would be reasonable to assume that if you've had a mask that you've kept in a nice, clean, dry place, maybe in a paper bag to provide ventilation for a couple of days, the risk of any persistent virus on that mask is low. But I don't have any data that I can point to tell you that it's absolutely safe. But certainly that's going to be a better option in many settings than no mask. So one of the ways the virus may spread, and SARS, which is a similar virus, was known to spread, was what's called a fecal-oral route. So that means it can come out of the body in bowel movements. Having really careful hand hygiene after using the toilet is important. If your plumbing can handle it, consider flushing the toilet paper. And one way that the virus could possibly spread would be through common piping in a house. So in your bathroom, if you have a drain in the floor that's not frequently used, it's really important that you put water, potentially with a little bit of bleach, in those U-traps at least once a week to make sure that there's no chance that any air could come upwards from another residence. Now, the chance of that is really low, but it's generally a good practice to keep your U-traps filled to avoid any risk at all. And finally, with the question of aerosol transmission, I've had people wonder about whether using the heat in your workplace is safe, and whether, in fact, having the heating system on would then recirculate viruses. One thing we know is the viruses don't like heat, and using the heating would be a safe choice to keep the environment warm inside. Ventilation, when the air quality is good, can also help, but you do want to pay attention to the air quality as well. So one question people have looking at all of these modes of transmission is, can you walk outside? Dr. George Hu is going to be addressing the health benefits of being able to be outside and where it's allowed, where your jurisdiction allows you to walk outside. Being outside in the open air 2 meters away from other people can be generally considered a very safe activity and quite healthy. Getting some exercise is going to help cope with the stress for those of you who are able to walk about freely. And finally, let's see. Yeah, so being out in public, being very mindful of hand hygiene is the most important. Mask use as required and when you're going to be in crowds. Being careful not to touch your face is really important. Being careful not to frequently adjust your mask, in fact, because that could be counterproductive if now you're touching your mask, which may in fact be contaminated. But with all of these steps and good careful attention to your overall health, you can protect yourself and your family from the virus.